We try to talk to people at the beginning of the flu and pneumonia season to remind them that as people get sick over the winter holidays and into the early winter, that it's important to see your doctor, but antibiotics aren't always the answer to an infection. Antibiotics don't treat viruses, and they actually have harmful side effects. So they can also be associated with diarrhea, allergic reactions, harm to the kidneys, and so we want to avoid any harm with unnecessary use. Especially now when we have influenza and COVID, there are antiviral medications available, so it's important to really talk to your doctor about your symptoms so we can make sure you're receiving the best care that you need. For the inpatients, we look at every patient who meet criteria for what antibiotics they're on, how long they're receiving antibiotic, what's the diagnosis. In the outpatient setting, when we're dealing with common infections like a cold or a sinusitis, we've done a lot of education with our urgent care and primary care physicians and APPs to make sure that they're aware of appropriate length of therapy and what the best medications are for different bacterial infections when they're needed. The more we use antibiotics inappropriately in the community, the more regular everyday people are going to become colonized with resistant bacteria. And then when you need an antibiotic, we won't have any to give you. We always have education available on our website. And nationally, we work with the CDC every year at this time to provide information for patients. We actually are nationally recognized for the work we've done with our providers, our practices, and our patients on appropriate education for when an antibiotic should and shouldn't be used.